Hi, I'm Dr. Ted, and this is Fracture Friday. For this episode, I have a calcaneus fracture. The calcaneus is the bone in your heel. It's a very hard bone to break. It usually is a result of a fall from a height, usually an elevated height, like from a ladder or from a deck, maybe around 20 feet or so. It's a relatively high energy injury. It has a ugly personality because it can lead to what we call subtalar arthritis, so the joint between the talus, which is the bone below your ankle, and the calcaneus can get arthritis in it, and that joint is responsible for walking on uneven surfaces. So like hunters or people that walk on the beach all the time or something like that have trouble with maintaining a flat foot on an uneven surface with subtalar arthritis. So we have to be very aggressive in regards to try to maintaining that subtalar joint. So you can have calcaneus fractures that are non-displaced, that don't involve much displacement of the subtalar joint and don't involve any kind of surgical intervention, or you can have what I have here, which is a lateral of a very comminuted calcaneus fracture with a lot of involvement of that subtalar joint. The joint, this posterior facet of the joint's normally shaped like a V. The posterior facet of that V is like crushed flat. That's a bad situation for if we were just leave it like this for avoiding subtalar arthritis. So what's done for this fracture is what we've done here, which is to openly reduce and internally fixate the fracture. This fracture is also prone to having skin problems after surgery. In other words, the flap of skin that's associated with the incision can die and lead to exposed hardware and all kinds of nightmares for the patient and the orthopedic surgeon. So typically these fractures are splinted for anywhere between 2 and 3 weeks before they're fixed to allow the swelling to go away. Once the swelling starts to dissipate, then we'll do this open eruption internal fixation. So I have another lateral x-ray here, a post-op lateral x-ray that shows the plate that we use is kind of a very funny shaped plate that we fix over the lateral aspect of the calcaneus and reconstruct the subtalar joint. If you look at these x-rays very closely, you can see that some of the bone fragments, especially at the bottom of the foot, don't seem to be completely aligned. We don't get overly excited about those. It would be nice if I had gotten it closer, but it didn't happen. And what we really want to do is get the joint as perfect as possible. The other part of the bone will heal and it'll do just fine. So this patient should hopefully do really well if we can avoid post-traumatic arthritis. Hope you enjoyed watching this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.